Hello and welcome back to TBWP 21. This month we are focusing on the physical wellness pillar. We are excited to present you information provided by certified professionals concerning regular self-care and maintenance.
These professionals are educated and actively providing services in their field of expertise. We now invite you to sit back and listen to advice concerning routine physicals, dental care, mental health checks, and aches and pains. To start us off, April will be visiting with nurse practitioner Dr. Mark Willis.
Hi everybody. Today I have with us Mark Willis, and I'm going to tell you a little bit about Mark. Mark is a nurse practitioner specialist in Pocatello, Idaho. He graduated with honors in 2017 from Simmons University. Mark has more than 4 years of diverse experiences as a nurse practitioner. Mark Willis affiliates with Portneuf Medical Center, cooperates with many other doctors and specialists in many medical groups. Mark also is a medical director at Quinn Meadows Rehabilitation and Care Center in Pocatello, which is a Tannabell facility. We are so happy to have you with us, Mark. Mark is married to Sarah, and they have 2 children, 1 boy and 1 girl. Thanks for being here.
Thank you.
Out of your busy schedule. We know you're busy.
Appreciate it. It's good to be here.
Yeah, good. So we are focusing on personal health maintenance this month. So wanted to ask you some questions in regard to that. And the first one would be, tell us how often you think people should go and see their health practitioner. How often should that happen for like regular exams and maintenance?
Well, April, it's kind of a tough question because it depends on who you're talking to.
Okay.
If you're otherwise healthy, don't have any medical problems, an annual visit probably is enough.
Okay.
That's usually enough to get labs, screening, check your vital signs, make sure everything's going okay.
Right.
People who have diabetes, high blood pressure, other medical conditions, then definitely you would want to see your provider more often.
Okay.
Diabetes, they typically say every quarter. So
Oh,
every
wow.
3 months you could
Okay.
you could go in and be seen.
Right.
But there's also, if something just doesn't feel right, you're more tired than normal, things like that, then definitely make that appointment. You don't have to wait that whole year to go see your provider.
Okay.
If something's not adding up, then definitely make
Okay.
that appointment and get in and get seen sooner rather than later.
Rather than waiting.
Yeah.
Okay. What is it you check during a maintenance visit? What exams do you do? What blood tests do you include that are usually pretty regular?
So with just a wellness visit, definitely we're going to check your vital signs.
Okay.
Your vital signs are going to tell us a lot.
Sure.
Check your blood sugar, check your blood pressure, make sure you're not getting high blood pressure.
Okay.
But then there's a series of labs that you want to check.
Okay.
Check your cholesterol level, check your electrolytes.
Okay.
So like your sodium, your potassium, calcium.
Okay.
And then check your blood counts. So we'll look
Okay.
at your white blood cells. How well is your immune system functioning?
Okay.
Whether or not there's any anemia. Are you low on your red blood cells?
Gotcha.
Those are all routine tests that
Okay.
we would check.
Okay.
Now, if you had other underlying conditions, there's
Sure.
definitely a ton more labs we could do.
Sure. Like if I had a complaint about something specific, you would then do further testing.
Absolutely.
Okay. All right. What are some of the signs that we should look for in our overall health that would tell us, help us to recognize maybe that something's not right, something's off, and we should make an appointment? What are some of the things maybe that you see regularly that people are like experiencing, and maybe they waited too long to come and see you, or you could give us some advice about when we should pay attention to something?
Well, I think the biggest one, pain.
Okay.
Pain is a kind of a way your body tells your brain, say, hey, there's something not right here.
Okay.
So pain can definitely be a good indicator. Increased fatigue.
Okay.
Not being able to do what you normally would like to do
Okay.
because you're just overly tired.
Okay.
That would be kind of a red flag, be like, maybe you ought to get some things checked out.
Okay.
Other one would be a sudden increase or decrease in weight,
Okay.
unintentionally. Now,
Okay.
if you're working on losing weight and you're doing a good job at it, great. Don't need to
Yeah.
go see your doctor
Right,
for that.
right.
But if you lose 20 pounds in 2 weeks,
Whoa.
absolutely.
Something's up.
Something's not right.
Okay.
And that's where I've seen that people have waited too long.
Okay.
Whether they're ignoring things and then the condition gets worse, and then by the time they do come in and get seen, it's significantly more major that could have been prevented had they
Okay.
sought treatment sooner.
Okay, wow. Very good, thank you. Some people are afraid, I've heard this, of course, and I know you probably have too. I hear this, I can't go to the doctor because I can't afford it. In fact, I know somebody right now that is saying that, having terrible hip pain, and they're like, I can't go because I can't afford it. What do you say about people that are afraid of the costs? Maybe they don't have insurance. What do you advise people to do if they're not, they're not participating in an insurance group?
Yeah, that's tough. That is a
It is, isn't it?
tough place to be in. My advice is don't wait.
Okay.
Okay. There's lots of government programs out there that can
Okay.
help. And I'll be honest, I'm not the best at listing off all those programs,
Okay.
but they're
out there.
They're out there, and
Okay.
you can seek out help,
Okay.
financial help for medical problems. But
Okay.
my thing is with the cost, like we talked about a little bit ago, is if you wait too long and then seek treatment,
Right.
your cost may be significantly more
Good point.
than
Yeah.
if you sought treatment sooner.
Yeah, good point.
So I do understand, and I know there's a lot of people out there that struggle with finances and try to get enough to go see the doctor
Sure.
and wonder, is it worth it?
Yeah,
But I'll tell you, it absolutely is worth it. Because
absolutely.
if you can fix something sooner,
Yeah,
not have the huge complications of waiting,
right,
always better.
right. How often do you see people that have waited too long? Is that more common than people that don't wait?
Absolutely, that's very common.
Is it?
Yes.
Okay,
It happens all the time.
okay.
I see it almost daily.
Oh, okay,
So
Yeah.
don't wait.
okay, yeah.
It's just,
I think that's really good advice.
it causes more problems than not.
Okay, good
And
advice.
Even financially, it can make it even
Sure.
more costly if you wait.
Yeah, very good. Thank you. Mark, as you know, being in the healthcare field can be very stressful. And this magazine video is done for our caretakers and everyone that works in the healthcare field for Tannabelle. So what advice can you give to our staff members that are experiencing stress? A lot of them put in a lot of hours. When we were going through COVID, of course, then we would have half the staff had COVID and were out, and we had to staff with who was left. It's been a stressful last year and a half. What advice would you give somebody that is in the healthcare field?
Well, I'm no exception to that rule as
Yeah.
far as increased stress over the last year and a half.
Right.
My advice is take some time for yourself.
That's good.
Find those things that you enjoy. Be around those you love.
Okay.
Spend time with those people. Do the things that you enjoy.
Yeah.
Take time to step away from it.
Yeah.
You have
Good
to do
advice.
that every single day.
You really do. Yeah.
That's the problem. For me, that's the biggest way of dealing
Okay.
with stress. I love to go out and play with my kids. Takes my mind off of everything else.
Sure.
Exercise for me is also a huge one. I
Okay.
enjoy playing basketball and racquetball.
Okay.
When I'm out on the court, I'm not thinking about all the other stuff.
Right.
Stress goes away.
Yeah.
So you got to find those things
Okay.
that you enjoy, that you love to do, that will take away the stress.
Sure.
Even if it's just for a moment.
Right.
That is so important. You have to take care of yourself.
Very good.
As caregivers, we're always worried about who we're helping, who we're
Yep.
taking care of. But sometimes you have to take care of yourself.
Very good advice. Yeah. Thank you so much for joining us today.
Hey, you bet. Thank
You're
you.
a pleasure. We appreciate you coming.
Thank you, April and Dr. Willis. It really is important that we go visit our physician annually to ensure our health is in check. Now we will hear from Dr. Rick Fellows as Kelly sits down to ask him a few questions about dental health.
We would love to introduce Dr. Rick Fellows. He's a dentist here in Pocatello. How long have you been in dentistry?
I have been a dentist for 22 years.
Have you always been here in Pocatello?
I have.
Are you a Pocatello native?
I am not. I am a Preston, Idaho native.
Ah, but then
So-
you decided to open your practice here when you were done at dental school.
Yeah, I had a great opportunity to come here from a business perspective and moved here, and we love it. Didn't know if we would in the beginning, but yeah, we love it.
Good.
We're lifers. We're never leaving.
Never. Some people avoid going to the dentist as much as possible, maybe all of their life. What is something that you could say to someone who is really apprehensive about going to the dentist that would maybe calm their anxiety a little bit and encourage them to make it through that door?
Well, I think the first thing is that's normal. People are scared of the dentist. I'm scared of the dentist. So I think that understanding that it's normal, is kind of the start to it all. But you also have to understand how important it is. It is super, super important.
And you're not saying that just because that's your livelihood.
No.
It's just, you would say that regardless.
How many times a day do you eat? Lots. And if you don't have teeth, it's miserable every time you do it. Not to mention you're not getting proper nutrition, different things like that. So it's incredibly important. And people, there's a few things out there that are fallacies that people have that, I don't need to go to the dentist unless
XYZ.
my teeth hurt. Well, if this is what I can tell you, if you wait until your teeth hurt, 9 out of 10 times you're going to have a root canal. And nobody likes root canals. And in fact, that's my job, is to keep you away from having to have a root canal. So the fear of coming in, I get it. That's totally normal. I think one thing that you can do is making sure that you pick the right dentist that works for you, that fits you. I've had patients come in and interview me and say, well, how are you going to do this, and how are you going to do this? And I really appreciate it when somebody asks me or informs me that they're super nervous. If that's the case, there are some medications we can use to a certain degree, but I will make sure that I can do everything in my power to make you comfortable.
So how often should we get our teeth cleaned? How often should we visit the dentist and get our teeth cleaned?
Every 6 months. Well, here's the deal. The only time certain places in your mouth get cleaned is when you're in here. That's the first thing. For example, flossing. And you can floss and you can get to most places, but even with floss, you can't get to every place in your mouth. If you don't floss, the only time they're getting cleaned is when you are in the dentist. So if you've haven't been to the dentist for a year and you don't floss, then you've got stuff that's growing in between your teeth for a year.
And you have stinky breath.
And you have stinky breath.
So go get that. I love flossing.
The other thing that's super important is our job is to educate you guys. And you're not supposed to know everything about what's going on in your mouth or everything about teeth. That's our job, to inform you. What's the difference between gums and periodontal disease, which is what typically causes people to lose their teeth. People don't usually lose teeth because of cavities. They might lose one tooth because of cavities, but when they lose all their teeth, it's because of gum problems, not because of cavities. So I can theoretically have somebody come in, have not one cavity in their whole mouth, and lose all their teeth.
Oh, really?
Because of periodontal disease. So you guys aren't supposed to know that. That's my job, but I can tell you, I can educate you, and I can help you along the
So you can
path.
see that when you're doing a regular dental exam, there are things that you can look for that help you see
Absolutely.
disease.
Well, when periodontal disease comes from the fact that we get buildup around our teeth, our body doesn't like it and it pulls away. So we start like this with the tooth in the bone, and you get stuff built up, and your body doesn't like it, it pulls away, and eventually your tooth is flopping in the wind, and I can just pull them out like this with my fingers.
Really?
So yeah, that's true. That's a true story. So that's why people lose their teeth for the most part.
So what are some things that we should avoid? What are some things that we do that impact our dental health? Our
Okay,
teeth, our mouth?
well, again, first thing, getting in every 6 months is the most important thing. Second thing is brushing. And when you talk about how do I keep my teeth clean? 99% of it is mechanical removal of plaque. And
So by that
tartar.
you mean brushing,
Brushing.
flossing.
Yeah, it's like if you take your hose and squirt your muddy car off, how much mud do you get off? You might get a little bit. You can rinse with mouthwash and you might get a little bit, but the mechanical removal, getting that mid on the car, is what gets it off. So that's 90% of it, and that even includes toothpaste. I mean, people will say, well, what toothpaste should I use? The biggest thing is the brush, not the toothpaste. There's little, pumice, little things that help, a little grit, kind of like my mom used to use Comet in the sinks. It has a little grit in there.
Yeah.
That's in toothpaste. That helps. But the biggest thing is mechanical removal. So floss. If somebody can't floss, water picks work really great. But a brush is the biggest thing.
Okay.
That helps.
Is there anything that we do that's particularly damaging to our teeth, to our dental health? Besides going to bed with candy in your mouth.
Yeah, the diet's a big deal. Probably the biggest things that hurt people's dental health or their mouth is smoking and chewing.
Chewing tobacco.
Terrible for your teeth. It stops. Your mouth is this thing that is continually, because there's so much infection in your, or bacteria infection in your mouth. It's constantly healing. Nicotine, in general, inhibits collagen formation, which is kind of the building block to healing our mouths and healing our tissue. So
I get chewing tobacco, but that surprises me actually that you say that smoking is actually really bad for
exact same
because
thing.
you're just sucking in air, but you're sucking in stuff.
Yeah, well, nicotine, and it gets in your body systemically as well as it has to pass through your mouth as well. So it's they're both really hard on your mouth. There's no question about it. When you talk about things like dry sockets, if I have a tooth extracted, 99% of dry sockets come from people who smoke or chew tobacco. Just
Interesting.
is what it is. So your mouth can't heal itself very well when you smoke. So things like periodontal disease, cavities, everything, it just gets way worse if you smoke or chew tobacco.
So if not for your physical health, for your lungs and your heart, do it for your beautiful smile.
Yeah, do it for your mouth.
Yeah. Okay, and so what if we have some people who say, I don't have dental insurance, I can't go to the dentist, I don't have dental insurance. What do we tell them?
Well, I'll get on my soapbox a little bit. Dental and medical insurance, they get lumped together, and they're very different. In dentistry, you don't have catastrophic things that you have to deal with. You're never going to, because of a toothache, well, hopefully not, because of a toothache, be in the hospital for 6 months, or because of a broken tooth. So the overall cost is not nearly as high. And in society, we believe that we have to have dental insurance. If a person were to take, a certain amount of money and save it, that they would be paying for an insurance premium anyway. They would probably pay for all their cleanings in a year and all their dental work easily.
So it's like between $200 and $300 to come in and get your teeth cleaned and your X-rays every 6 months. So if you're saving,
I can't
figure out the math for that. For 6 months, divide $300 by 6 months. What is that? $50 a month.
$50 a month.
Then you could do that.
You could do that.
So our dental health really impacts the rest of our body, doesn't it?
Absolutely.
It does.
Absolutely, it does. If we can't get proper nutrition,
It impacts how clearly we think.
Impacts everything.
Impacts how our body moves. It impacts everything.
And it's amazing, there is also a huge psychological factor with teeth. It's amazing how many teeth
you feel
will say,
comfortable smiling or not.
Yeah, how many people will say, if I lose my teeth, I'm just going to die? Or how many people, when they do start losing their teeth, their whole body, the way they look, everything just changes. Or when I put veneers on somebody and they have new teeth and they just walk out with a smile from ear to ear and their confidence goes up, everything. So mental health is really, really tied to teeth. It can be really
Any last words of wisdom you'd like to share with us, Dr. Rick Fellows?
The biggest thing that I can share with you is just find somebody that you fit with as a dentist and get in there and communicate with them. If you, like I said, if you feel anxious, if you have concerns, whether it is financial or whatever it might be, communicate and talk to them. The biggest thing is if you wait until you have problems, big problems. If you don't change the oil in your car for 20,000 miles, all of a sudden you got to change the motor, and it's a big issue. So if you kind of bite it off a little at a time, it's really, really easy, and you don't have big issues.
It was a pleasure getting to visit with Dr. Fellows. He made some great points about how important it is to take care of our oral health because of the effects it has on more than just what is going on inside our mouth. Now, for our final two guests, we will hear from Sean Aquina, licensed professional counselor, and Sarah Cairns, doctor of physical therapy. Sean will be addressing mental health, and Sarah will be sharing information about injury versus muscle soreness.
Hi there, my name's Sean Aquina. I work for the Department of Health and Welfare, and I do the discharge planning for State Hospital South, and so I help them with the transition into the community. I provide individual and group therapy, and for this interview, this is just according to me, so this is from my view of counseling and how it can help people. It's important to attend to our mental health because mental health, like other aspects of our life, it's foundational for our happiness and for our quality of life. So when I'm not healthy mentally, then that affects every other aspect of my life. It affects my social life. It affects my work. It affects all these other aspects of my life. So that's why I think it's important. It's really foundational for the quality of our life and the way that we experience things. Yeah, so I think that what's important is when you go see a therapist, you just have a goal. So you may not have a lot of issues that you're dealing with. And that's fine to still go see a therapist, but again, I think what's important is that you just have a goal in mind for what you want to accomplish. A therapist can help a person pick out patterns of behavior. I think that's pretty obvious in most of us. Most of us behave certain ways, and sometimes those are healthy ways, and sometimes they're not. But I think that, again, when you go see a therapist, you really should have a goal in mind. And maybe if you don't have a goal in mind, you should be working with that therapist to establish a goal so that counseling can go a lot of different ways. And I think that it's really easy to get off track when you see a counselor. So I think it's important to have a goal in mind and to work towards that goal. Focus on your quality of life. Focus on, you seeing yourself being more happy in your life. Focus on the benefits that you're going to get from it. That is the skill, and that's what I'm teaching everybody, which goes right into self-care and the importance of, and how when we're all caretakers in one way or another. So that's what I constantly talk to my spin class and my yoga class about, that we're all caretakers in one way or another. So it's really important that we're doing a lot of self-care, because again, if I've taken care of myself, then I'm going to take better care of everybody else, right? But I have to be in a good place myself. So what I'm teaching people is, again, it's really related to that. It's when you're doing something for you, make sure that that's where your focus is, right? If I'm at the gym working out, then I'm focused on my breath, and I'm focused on the burn of the muscle, and I'm focused on the pressure on my arms. I'm focused on all of that. And if I'm focused on that, then I'm not focused on the stress of the day and what somebody said to me and how I was upset about that or this or the other thing. So that is the skill right there, again, is that whatever you do, focus on that. So like even in the car, I mean, I think that sometimes if we've had a bad day at work, right, we're in the car, and what are you thinking of? You're thinking of, yes, you're thinking of she said this and he said that, and I'm not getting paid enough, and this is ridiculous, and that's what you're thinking of. You haven't left that at work. So the skill, again, and I practice all the skills that I teach. The skill is, there's a car in front of me. There's a light up there. Here's the road. It's kind of hot out here. Man, I'm grateful for air conditioning. So it's all of those things. So it's really staying right in the present, which is really why I love yoga. Has just been really transformational for me, because yoga really has taught me that, to focus right in the moment, focus on my breath, focus on my body, clear my mind. I think one of the most helpful things that I say in my yoga class is this: notice where your thoughts are. And the reason why I say that is because my thoughts start to wander, and I think, oh, if my thoughts are wandering as the instructor, I know their thoughts are wandering. And so again, it's really, it's being okay. So part of that self-care is just being okay and understanding it's okay and really important to take care of myself. And also, when you go and do those self-care things, that you're really focused. I mean, like hyper-focused. Because again, and this is what I tell my classes, my yoga class especially. If you could focus 100% of your attention on your breath, okay, because that's one of the focuses of yoga. If you could do that, and think about that. If you could focus 100% of your attention on your breath, then you're not thinking of all the other things that stress us out and you can be anxious about, right? Anxiety is the most common thing that I've seen for the last couple of years, and it's definitely it's ramped up quite a bit in the last year. A lot of anxiety because, again, our minds can worry. They worry, they go crazy. We are constantly pulling thoughts in, and then we've got what I would call intrusive thoughts coming in. And so if I can focus all of my attention here, rather than all of the things that I can worry about, you literally give your mind a break from all the chaos of the world. So yeah, we talk about self-care and just how counseling therapy can be a great way to get some self-care, to practice self-care, to get some ideas and develop some skills, learn some skills that will help you just be in a better place or just increase the quality of your life. There's lots of agencies that provide counseling right now. What I've heard, I haven't called myself, but what I've heard is that you could be put on a wait list. But what I would encourage people to do is to reach out, get on the wait list, because there can be some really good benefits to seeking counseling. And we're talking really about the quality of your life. That's what I was talking to a client of mine a while back. She said, Sean, it seems so hard to do this. And there's so much work and it's so difficult. And what I kept on bringing her back to is, we're talking about the quality of your life here. We're talking about your level of happiness in your relationships, at work, your personal stuff, your spiritual life. We're talking about your level of happiness. So that's probably why I would encourage everybody to keep on trying to find that right counselor. Again, the most important part of being with a therapist is that relationship. You really have to have that connection. So even if, as frustrating as it might be to wait 3 months to get into a counselor, to find out that maybe it's not going to work out, to get on another wait list. Again, we're talking really about people's their quality of life and their happiness. That's I don't know that you can put a price tag on that.
Hi, my name is Sarah Cairns, and I'm a physical therapist from Meadowland Therapy, and I wanted to talk to you a little bit about nagging pain. So I want to tell you the difference between muscle pain and injury. So most of the time, if you work out and you haven't been working out in a long time, you get sore. Most of us are aware of this. And so yeah, I have a leg day, I go sit on the toilet, I'm like, oh, that's muscle pain, that's gonna go away. You probably haven't injured yourself, you just worked those muscles, they got sore, and it's how you build your strength. So that's okay pain. If you go to the gym and you hear a pop, you feel a specific pain kind of starting, that's usually an indication that you're doing something that's going to hurt yourself, or you've hurt yourself. So pain can be different for every single person. And so basic kind of injuries that you can do is you have a tendonitis where you do a repetition of something too often, and then you get a tendonitis, you get a swelling in that joint. So that pain's going to last longer. It's going to be more in a joint than the muscle, and that's some things that you want to like pay attention to and try to avoid. Other kinds of muscle pains that you can get is you pull a muscle. Now those ones you probably will heal, the pulling your muscle can heal on your own. You don't have to go to the doctor for, right? You're like, oh, I kind of pulled a muscle, I got a Charlie horse, it hurts a little bit, and ice and ibuprofen, Tylenol make it go away, and it heals within a week. If it lingers and it's lasting longer than a week, that's a good time to go to the doctor. If you have pain, you know, doctors are aware you have some aches and pains, and they don't want to hear you complaining all the time. So and we don't want to be complainers, so we don't tell our doctors. But if you have pain that's lasting longer than 3 months, you're getting into chronic pain. That is a good time to go see your doctor or a physical therapist, and so we can try to address and figure out why you're having those pains. So a nagging pain would be you do something every time you do that one specific motion that hurts. So for example, when I was pregnant, I would clean our tables, and the tables in the treatment room are a little lower. So I'd arch, and I would arch my back, and I would get some nagging pain right here. I didn't realize it was when I was cleaning the table. It was just as I stood up, I'm like, oh, yeah, that hurt a little bit. Or at the end of the day, I'm like, man, I'm starting to feel sore here. And it wasn't just one day, it was like a couple of times. And then I was like, okay, what am I doing? So I'm a physical therapist. I know how to problem solve. And I'm like, okay, it's in my SI joints. What am I doing? Oh, yep, I did arch my back. Let me try to keep my back straight and clean and wipe my table with my back straight. I didn't have any more back pain. And so that's what a physical therapist can do for you is, first off, you have to recognize, oh, I have some pain. What am I doing wrong? Well, if you don't know what you're doing wrong and you can't fix it yourself, call a physical therapist. Come in, let us see what's happening. So a lot of times when you're transferring patients, you have your back arched, or you're doing something, your knees are too far forward, your feet aren't stable, your shoulders are not in the right position. There's so many things that can go wrong when you're transferring patients. So we want to make sure that you guys are safe. And that you guys recognize, yeah, every time I transfer or I do this certain motion, I'm having pain. Come talk to a physical therapist. We can try to figure out where your shoulder blade's not gliding, your feet aren't supporting you, your butt's not supporting you, your abs aren't supporting you. Usually it's a muscle weakness somewhere, and then you're overusing your strong muscles instead of your weak ones, which goes into my next thing. So some people can recognize, oh yeah, I have really weak ankles. I know my feet is an issue. I'm gonna try to do exercises and try to strengthen those feet. Or I deal a lot with abs because I do pelvic floor physical therapy. I get a lot of people who have that separation in their abs, or they have incontinence, and they'll look online and they will see videos or exercise programs that they have to pay money for, and they will do those videos, and they come to see me and they're like, yeah, I paid for this video, I worked my core, and I still wasn't seeing any benefit. And they were still leaking, they still had that separation of their abs. Most of the time you don't recognize which muscle is your weak one. You will overuse your strong muscles. So if you're doing incontinence, most of the time you have upper ab strength. You grip around your rib cage instead of gripping your lower stomach. And so when I've had some patients do those videos and they're like, yeah, I did those videos, it was junk. They didn't do anything for me. And so I asked them what exercises they were doing, and they showed me, and I was like, yep, you're working right here, not right here. And so I give them a few cues, tuck your pelvis, how to engage, what they should feel, and then they were able to make more progress. So if you're having nagging pain, some of the things that you can do is talk to your doctor. You can try to treat it yourself. Most of the time, ice and heat, you play with one or the other and see if it goes away. If it does not go away, then most of the time you need to see your doctor first. Insurance usually likes when you get a referral from a doctor. We are legally a direct access state where you can come see us first, but if your insurance doesn't cover it, then it's no good for you. and you have to pay cash. So talk to your doctor first. The doctor will decide if you need imaging, x-rays, MRIs, CT scans, whatever the injury is. Most of the time they're like, no, we won't do imaging, we'll try physical therapy first, and then they will refer you to a physical therapist. If you like a certain physical therapist, you can ask your doctor to send me to that specific therapist. A lot of times doctors have relationships with physical therapy companies, and so they'll send you to X, Y, and Z for knee, or another one for shoulders. And so if you look online and you're like, no, I don't really like the reviews, you can always, choose your own therapist, like Meadowland Therapy.
Thank you, Sean and Sarah, for sharing your knowledge with us. We appreciate your thoughts and advice.
As mentioned previously, many of our employees have been focused on caring for others over the past year and a half. So if you've been putting off caring for yourself, we encourage you to take time this month to schedule appointments to ensure your own health and well-being are in check.
Also, we'd like to remind you that you have options. If you are seeing a doctor, dentist, counselor, or physical therapist that you feel doesn't provide the level of care you are looking for, don't be afraid to shop around and find someone that better fits your needs.
And as always, your self-care shouldn't be put on hold. Take the time to care for yourself and get help. Your quality of life shouldn't be second to anyone else's. Thank you for watching this episode of TBWP 21.
Thank you. And we want to bid a fond farewell to our Veronica. She is moving on and up in the world. She's taken another job because she's relocated, and we will miss her. We've appreciated her co-anchoring our TBWP 21 and wish her well on her journey.
Thank you.
We hope you find joy.